it's called a health system, it's sickness based.
Mm.
So we are trained to treat illness as opposed to improve wellness. And so that's one of the dilemmas about our healthcare system. So we need more integration with all of the exercise physiologists, the dietitians, and psychology. So when we think about how to actually do this holistically, we need lots of people, but the country can't afford that. Individuals can't afford that currently based on the Medicare system. And so you've got to have a diagnosed mental illness to actually go and see a psychologist. So with using Medicare, you can go and see a psychologist to actually, under your private health insurance, you don't need to have a diagnosis, you don't need a referral, but under Medicare, you do. To go and see a dietitian under Medicare, you need to have a long-term health condition that exists already. You can't go there just simply, I'd like to have a chat about my diet because I'm not sure whether it's a healthy diet or not. That's the way that Medicare only funds people once they've got something. So they're in straight away. We've got dilemmas.
Okay, so if you had a magic wand, what would you change to fix things?
Okay. Well, I think one of the things that we need to have is practices that have a whole raft of different health professionals within them. That would be helpful because then we'd actually be working, shoulder to shoulder with people that go, okay, so Nancy, you're a dietitian. What's your role with this person that I'm seeing? We could have case conferencing. We could actually have much better discussions, maybe at which would have right, a weekly catch up with a team to review what's going on. And so the funding of that is actually going back to the magic wand, is having block funding to actually be able to, and block funding is different to funding by Medicare, which is based on every time I see someone I get funded, where block funding is a block of money paid to a practice to keep to do certain activities, but it's no one's counting how many you must do to get a certain fee. And so it's in many parts of the world, the system of payment for primary care is often a combination of block funding makes up a third of the payment. The fee for service, which is what our current Medicare system is, makes up a third of the payment. And then we have another third of the payment is based on you're enrolled at the practice, and there's an enrollment fee paid per year to the practice to keep you well. I'm accountable for your care. So those sort of models where you have different streams of funding coming in, and then you've got to just you can make a decision, right? As a practice, I've got this amount, which is a block fund. How will I spend that? Who will I employ? How will we use that to actually for our time where we can actually sit at a table together and talk about, what the dietitian does, what or who can we refer to within our practice, where currently that time is not paid. The time as a GP is paid only if I'm seeing patients. Where block funding says, right, you can actually use this funding to be more innovative, to actually work out, well, how can we keep this population well? If we've got, and you may have heard of something called My Medicare, where people are registering for My Medicare, where they say, right, Dr. Chris is my doctor. I'm registered with Dr. Chris. So now Medicare understands that. This has been around since about July 2023, I think it started. The clarity of the benefits are not there yet, but what will happen eventually when enough people are actually enrolled with the My Medicare program, then it'll be quite clear. This is the group of people that I'm accountable for, and the government will say, right, Dr. Chris, you're accountable for this group of people. We'll start funding you to actually keep them well. So that's where I think this will head in the future. Now, that's not written down anywhere, but we look at something called the 10-year primary healthcare plan, which we're in the third year of, that particular plan. It talks about new models of how to actually keep people well, reduce them getting long-term illnesses, and keeping them out of hospital. So we've got to actually do it differently to our current hamster wheel Medicare system.